And welcome to another Mark Bishop Show. Well, Medicare Open Enrollment began Friday, as we know, October the 15th. And people with Medicare have until Tuesday, December 7th to make changes to their health or prescription drug plans or select a new plan for 2022. Now, those who miss the deadline will likely have to wait a full year before you can make changes to your plan. That doesn't sound too good. So why compare Medicare plans in the first place? Well, every year Medicare health plans can change by cost, coverage, and participating providers. Even if a person with Medicare is happy, with their current Medicare coverage, not all plans offer the same benefits. Well, that's right, isn't it? Meena Seshamani, MD, PhD, Director, Center for Medicare for the Centers for Medicare and Medicaid Services. Welcome.
Thank you for having me, Mark.
Well, comparing their current plan, share with us about options and help to potentially find coverage.
Yes, because as you mentioned, it is very important for people to compare plans because their healthcare needs can change from year to year and what the plans offer can change from year to year. So to be able to review and compare plans, you can simply go to Medicare.Gov, that's Medicare.Gov, and click on Find Plans. You can add the prescription drugs you are taking to the plan finder and do a side-by-side comparison of plan coverage, cost, and quality rating to help you more easily see the differences between plans and feel confident in your choice. Now, if you choose a new plan for 2022, you can enroll right there. And if your current coverage still works the best for you, then you don't have to do anything further.
Well, Dr. Seshamani, the Plan Finder provides a very personalized experience, doesn't it, to help people with Medicare to learn about the different options and to easily select the coverage plan that does best meet their needs. It's not a hard thing to do, is it?
That's right. Medicare.Gov's Plan Finder can help you to compare plans on coverage, cost, and quality. In addition, if you would like further assistance, you can contact 1-800-Medicare. So that phone number, we are here at it to help 24 hours a day, including weekends. You can call 1-800-Medicare, and when you call, they can also provide you with information on free personalized health insurance counseling in your local community. So they can also provide you with contact information if you would like local health insurance counseling as well to help you make the best decision for your needs.
And that's very important, and particularly the local part. Dr. Seshamani, why is open enrollment important for people with Medicare?
Well, Mark, people's healthcare needs can change from year to year, and health plans can change their offerings each year. So that's why shopping around and comparing plans can pay off. People with Medicare should review their coverage to decide if there are better options based on changes to their current plan, their personal budget, and their health needs. Because as you mentioned at the start, even if you're happy with your current coverage, you might find something that's a better fit for your budget or health needs.
All right. So, is it limited? I mean, who can participate in the Medicare Open Enrollment?
Open enrollment is for all people with Medicare, which is health insurance for people 65 or older, certain people under 65 with disabilities, and people of any age with end-stage renal disease.
Okay, now we've talked about how people can compare. You've got the opportunity of 1-800-Medicare, okay, or contact the State Health Insurance Assistance Program, which is SHIP, S-H-I-P. But, of course, the website was very important where you can actually do the whole plans itself. Now, why is there an open enrollment end? December the 7th looms up as that number every year. It's pretty scary. Or I miss out or I'm gone for another year. When does Medicare open enrollment end? Literally, is it that date? Or, if something happens, can people still get support?
Yeah, Medicare open enrollment does end on December 7th. That is the last day of the open enrollment period when people with Medicare can shop for a plan for 2022 and make changes to their coverage if they decide to. After December 7th, people with Medicare will have to wait until next year's open enrollment period to review coverage options in Medicare. So that's why we strongly encourage people with Medicare to review their coverage right now and see if they can find better value. Because as we've discussed, even if you're happy with your current coverage, you might find something that's a better fit for your budget or health needs. You know, the other thing is this upcoming Thanksgiving holiday is a great time to talk with your loved ones about Medicare open enrollment. Whether you're gathering in person or connecting virtually, now is the time to speak with anyone closest to you about your healthcare options as well.
All right. So what happens then if people do miss the deadline?
If people do miss the deadline, they will have to wait until next year's open enrollment period to be able to review coverage options in Medicare. So that's why it's so important to do it now. And, you know, one other reason why it is so important to look now is because there could also be help for paying for Medicare costs. So, you know, people with Medicare may have faced challenges paying for health care. And if so, you may qualify for Medicare savings programs that are run by your state that, again, during this open enrollment period, you can, you know, get more information about. So these programs are for people with limited income and resources to help pay some or all of their monthly payments to Medicare, co-payments to the doctor, prescription drugs, and other costs. And this could add up to thousands of dollars each year in savings, depending on your situation. So if your income for 2021 is below $18,000, it's worth contacting your state's program to see if this might be available to you. And that phone number I gave, 1-800-Medicare, you can call 1-800-Medicare, and they can provide you with the contact information to see about that local program to help you pay your health care costs.
Right. So this time of the year is pretty critical, folks. Get off that couch and get moving with it because, look, if you've got a limited income, you know, you could qualify for help. The state to pay for Medicare premiums and other costs. And as the doc says, all you've got to do is dial 1-800-Medicare and you can go from there. I mean, help in paying for Medicare costs. I mean, that's a nice thing, doctor, isn't it?
Yes, absolutely, for those who qualify.
For those who qualify. So, you see, this time of the year is critical and it does finish. It's not like, oh, well, look, you know, I can amble in a week later. They'll still talk to me. They'll still take me. They'll still do this. They can't. They can't. It's all in the computers and it's all done to the dates. And why miss out? You know, why wait another year when you could have done it now? And that's what the doc is about and trying to, you know, encourage you to move on it. It's a very important time of the year. Two things, 1-800-Medicare. And what was the site again, please, doctor?
Medicare.Gov.
That's simple, isn't it? Medicare.Gov. Well, Meena Seshamani, medical doctor, PhD, director, and the Center for Medicare for the Centers for Medicare and Medicaid Services. We appreciate you taking the time that you do, getting this word out, doctor. It's very important. And, you know, this time of year, particularly now, these days, very critical. So thanks for that. And is there anything you'd like to add just before we close?
Just to emphasize what, you know, we've been discussing here, how important it is to compare plans and pick what works best for you. And thank you, Mark, for having me, and thank you for spreading the word as well.
Well, very important, doctor. You do your end of it. We've got to do ours. This plan finder, just before we do go, I mean, it sounds terrific. All you've got to do is go online and, you know, look at the thing, and it can help you profusely. Plan finder on Medicare.Gov, correct?
That's right.
All right. Thank you, doctor. Lovely speaking with you. Have a good week.
Thank you. You too.